Thank you very much for joining us. Welcome all to the Practical Longevity Podcast, a space where we demystify fact from fiction in the longevity and functional medicine space and reveal your need to know info when it comes to prevention and healing. I'm Dr. Mary Pines. I'm the chief scientist at WellMe. I'm joining you here from near Vancouver, Canada, and we are live on Riverside, streaming on LinkedIn and Facebook too. Today, I have the pleasure and honor of speaking with an amazing functional medicine doctor joining us from fabulous St. Louis, USA. This is Dr. Henri Roca. Welcome, Henri.
Hello, Mary. Thank
Dr.
you for
Roca,
having me here. I'm so excited.
thank you for joining us on a Sunday. So, everyone, Dr. Roca is one of the very few physicians in the nation who practices holistic, integrative functional medicine. He understands there is no separation between the mind, the emotions, the spirit, and the body. He's skilled in interpreting these interconnecting complex webs of cause and effect to get to the underlying root causes of dysfunction. His extensive training allows him to use multiple modalities in conventional medicine, combined with health coaching, acupuncture, herbs, vitamins, supplements, minerals, medications, even hypnotherapy, as well as nutrition, massage, mind body therapies. He studied heart math, energy therapies, shamanic journeying, biofeedback, and yoga, among others. Wow, we are honored. Dr. Roga, thank you for joining us. And with that, I would love to sort of just kick things off with lens on root cause and functional medicine. So you take a root cause approach to health. How does that shift the way we think about ADHD, especially in adults?
Absolutely. Well, when we think about any disease, very often we wait until there's a diagnosis and then somehow you trigger or you target that diagnosis with a specific medication, but you're waiting until the diagnosis occurs. In functional medicine, we want to look even more deeply. We want to get to those underlying root causes, the things that ultimately bubble up into symptoms that can become the basis of the diagnosis. So, when we're working with any kind of mental health issue, we want to see what that terrain is like, right? The key questions are: does the body have enough to either help
Mm.
resolve the symptom or to help the body actually heal the symptom? And then secondarily, is there anything in there that's getting in the way? Anything, any kind of toxin, any kind of insult, any kind of personal experience that keeps the body from ultimately being able to achieve its own healing or work to resolve that symptom. So it's both about repletion and building up the terrain. And this is really that place of
Mm.
longevity where you really work to build up one's resilience to the inevitable chaos that happens in life. And then whether or not you have all of the resources that you need in order to be resilient. So it's those two questions are the main questions. Now, when we think about ADHD, then we have to think about, okay, well, what's the framework? Because lots of folks with adult ADHD don't actually get a diagnosis. They get a
Mm.
diagnosis, but on the basis of their few sort of reports, as opposed to truly having diagnostics. And that makes it very interesting and very amenable to functional medicine. Because the question is, how much of this is actually true as the DSM 5 thinks of it, ADHD, versus a challenge in life? And I'd like to talk
Right.
about that in just a bit, for just a
Oh,
bit. So, for example, for
mhm.
kids, ADHD is 4 times as likely in boys as in girls. But in adult ADHD,
Mm.
it's pretty much equal, about 44%
Right.
female, about 55% male. So why does that change happen? I mean, that's pretty an
Yeah.
interesting question. When you think about it in adult ADHD, the highest prevalence, the most number of people who have the diagnosis are between the ages of like 22 and 34. It decreases dramatically after 34, and it's even less before 22. Very interesting. So
Interesting.
what's happening
Yeah.
during those times of life? And this is a key part of the diagnostic framework, right? The DSM-5, if you're going by strict conventional diagnoses, would say that you need to have 5 symptoms of inattentiveness, 5 symptoms of hyperactivity, one or the other, or both, and it needs to occur for 6 months. And here's the deal: it needs to impact your social, financial, occupational life. It needs to impact that. So technically, if you have these diagnoses, but it's not impacting how you live your life, then it's not really something that is diagnosable per se. Yet many people will want the help. And I think that
Mhm.
goes toward this idea of explaining why the prevalence is different, both by age and also by sex. That, a lot of people may have some difficulty staying on task, multitasking, being focused, not being distractible, or being in a place of movement or fidgety or whatever.
Mhm.
But only when the demands of work come into play does that really emerge. And our work is different now than it used to be, right? I mean, we didn't
Mhm.
used to have immediate responsiveness. We didn't used to have more than a human should be able to handle on our plates at all
Absolutely.
times. And so this
Yeah.
idea of increasing productivity has sort of revealed these folks who may not have previously been diagnosed as a child with
Mhm.
ADHD or ADD or the combined type. So, I mean, I find that really interesting to
Mhm.
see how
Mhm.
societal pressures have come to bear on this diagnosis and caused it to really increase in recent years. So much so that somewhere between 6 and 10% of the population have that diagnosis now, which is really substantial, right? That's a lot of people. That's like upwards of 30 million
Mhm.
people. That's a lot. So
Incredible.
isn't that amazing when you put those two things
Amazing.
together? Now,
Yes, absolutely.
when we think about um, attentional issues, it is all about dopamine and norepinephrine and about how the brain works. So, when the brain pays attention, it either pays attention by choice, that's in the prefrontal cortex, the place that you make your choice, and organizes attention. And that's things like studying and things like work or performance, or it pays attention because something is very scary or pleasurable and rewarding.
Mhm.
And
Mhm.
and those are two different ways that attention occurs. In our
Mhm.
current life situation, very often the things that grab our attention are those scary or rewarding things, seeking pleasure, something that's pleasurable, or watching the TV news, something that's scary, right? And it's
Mhm.
everywhere. It's all over. It's everywhere.
Yeah.
Ultimately, that can actually deplete our neurotransmitters, just run through them, or cause us to secrete so many that the receptors like actually reduce. They're like, enough of this already. We have to reduce this input. So we're going to down
Mhm.
regulate the receptors. Isn't that interesting, right? You can see why
It's
all of this
interesting.
is coming to not ahead because
Uh-huh.
it's likely to continue to get worse over time. But we
Mhm.
really have to understand that it is a brain-based imbalance, and that
Mhm.
things like stress and the things we do for pleasure can have an impact. Now, you may
Mhm.
know that lots of folks with attention deficit play video games. I
Mhm.
don't know if you know, and many people haven't realized this, that the video game producers actually construct video games in order to be addicting. It is like gambling. So
Makes
moving
sense.
from one level to another, they do just
Mhm.
enough, take away a few tools, give you a few more challenges in an
Mhm.
unpredictable way so that you keep yearning for that next level. And
The
and that
gamified
is
experience. Yeah,
our life is becoming a gamified experience. Our
exactly.
life is
Yeah.
becoming a process where we become numb to
Mm,
chronic stress. And I call this the
mm,
bifurcation. And this is
mm.
and you know what can help you with the bifurcation? If you wear a
What's that?
wearable, if you use an Oura ring or
I
a
do.
Whoop or a Garmin, yeah,
Yeah.
I have my Oura ring on. And
That's
then you can actually look at your heart rate variability and see what your stress
oh,
score might be. Because when you reach the
right.
bifurcation, stress is so chronic for so long, you accommodate to it mentally, emotionally. So you're like, well, this is normal. This is just what happens all the time. Am I under stress? And very often there's nothing more than normal. But actually, it's still getting into the body. It's still affecting
Yeah.
how the heart works, how our vasculature works, how our inflammation works, how our brain works. It's reducing brain plasticity. So
Right.
much about working with, whether it's cognition or ADHD, is about increasing brain plasticity. And Mary, as you can see, once I start, I can keep going. So I'm going
It's
to
great.
pause.
Great,
Give
because
us
I'm
a
going to
chance
ask you
to
a
have a
question.
conversation.
Perfect. I love it, Henri. You're a fantastic speaker. I do have a lot of questions, but I'm going to ask you one for now.
Okay.
30 million people, 6 to 10% of the population diagnosed, which is probably a fraction. I'm curious what you think the underpinnings, like the relative proportion of this, the underpinnings would be genetic versus lifestyle. Are we talking about, or now we're shifting the balance of the population such that genetics is a very small piece of what's causing ADHD, and you would say it's mostly lifestyle based?
Well, that's a very interesting question. We don't have
Mm,
data on that, so I can't tell you for sure,
I
but I can tell you
figured.
what I think.
Yeah.
So I
Yeah.
think when we look at childhood ADHD, now there are many environmental influences that also trigger childhood ADHD. A kid who
Mhm.
has had attentional or activity issues since a very young age, that may be more likely to have a genetic predisposition with fewer things to sort of trigger it, with fewer inputs
Mhm.
to bring it into expression. And
Mhm.
it is very common for childhood ADHD to actually continue into adulthood.
Mhm.
And
Mhm.
it's pretty common for it to run in families, so that if your
Yeah.
brothers or sisters or parents had it, that you're likely to have it. But that data is all over the place, from 30%
Okay.
to upwards of 70% penetrance.
Okay.
So it's hard to
Interesting.
say, oh, yeah, my mom had it, therefore I have it. But
Mhm.
that's nothing to be ignored, because it is quite possible. So when
Mhm.
you think about adult ADHD, if you haven't had it as a child and you do have this experience as an adult, then I'd say really look at those lifestyle issues. It doesn't mean that treatments may not be helpful, because some
Mhm.
people have said, well, yeah, throw some stimulants into the water supply and everybody will be more productive. And that is entirely possible. Just like, you throw a little bit of antidepressant in there and everybody will be happier. Well, that's all possible,
Whee!
but that isn't the way we choose to do medicine or
Mm-mm.
life. But the point is that even though medication might help you, there may be other things that you can do. So I
Got
do
you.
think
Yes.
that as we get older, if it hasn't been a piece of our childhood, that it is very probable that there is a culmination of triggers that can ultimately reveal an underlying tendency. And just because um, there are some genetic correlates, doesn't mean that it is genetic. So, for example, the dopamine transporter, dopamine receptors,
Mhm.
and
Mhm.
and some of the molecules, some of the enzymes that break down neurotransmitters, all of those things could potentially predispose you. Even if you are MTHFR, methyl tetrahydrofolate reductase positive, that can predispose you. If you have the val
Mhm.
COMT gene, that can predispose you. So these things,
Mhm.
which are part of many people's experience, may, with increasing um, challenges, be revealed as an attentional
Mhm.
deficit.
Right. And I just want to highlight for everyone listening the bringing in that piece you mentioned around the plasticity of the brain and our capacity to actually shift how our brains work through shifting what you would call the triggers involved in triggering these behaviors and inattention and what we would be struggling with ADHD. It sounds like a lot of the time if it has arisen later in life. So just to highlight that as a little like, oh, this is very helpful, and there's a lot we can do without medications.
A lot we can do. And, as we talk about natural ways and functional medicine ways, we would hope that it could be resolved, but in more likely we'll be able to modulate it. And so that's a focal point. Is this a good time to talk
Awesome.
about some of those stress or mind body approaches?
Yes, absolutely. Please.
Okay. So when we brain-derived neurotrophic factor is the enzyme that helps the brain become more plastic. It helps neurons generate so that when you have more insight, more connections, you're building new behaviors which require insight and connections, the brain can make those changes. If it's low, then you can be doing all kind of work. And it's so frustrating because you're like, there's no
Mhm.
progress. I mean, I'm doing all the right things and nothing's changing.
Mhm.
It's like it doesn't stick. That's when we look at brain plasticity as a place for intervention. Um,
Love it.
One of the things that kills brain plasticity, well, we just mentioned it, chronic stress. And remember, if you're in that bifurcation where you don't even realize you're stressed, then you don't even know it's an issue. If you realize you're stressed, at
Mhm.
least you can target it and sort of get an idea about how much better you might be managing things. Again, look toward heart
Mhm.
rate variability, which is that beat to beat change in your heart rate. You take your pulse and you say,
Mhm.
oh, it's 78, but it isn't really 78. Every very short periods of time, I mean, we're talking about milliseconds, the heart rate increases or decreases in order to balance where you find yourself, in order to be able to calm down
Mhm.
or to get ready to leave, to deal with
Mhm.
stress. The more stressed you are, the more likely it is that that heart rate is plastered up in the 80s and 90s. And if
Mhm.
that's your case, then even if you don't think you're under stress, your body is receiving stress. Okay. So chronic stress will diminish this BDNF and help
Mhm.
brains become more rigid, harder to put in new thoughts, harder to see another side, harder to link your thoughts into behaviors and have them stick. So, very
Mhm.
important. Now, one of the things you
Mhm.
can do is to, number one, work to reduce the stress part of your automatic nervous system. That's your sympathetic nervous system. And those kinds of things are usually activity things. So exercise can help really well with this. Even doing things like dancing or shaking, right? I mean, we've
Mhm.
seen that when kids exercise for 5 minutes before taking a test and they have ADHD or ADD, then they
Mhm.
do better on that test. If
Amazing.
you need
Oh.
to complete something very focused at work, go out and take a walk, take a fast walk. Do that for 5 minutes every hour. Reset yourself so that you can come back and focus more completely. And high intensity interval exercise,
Mhm.
sprinting,
Mhm.
doing higher weights, faster reps for a short amount of time.
Right.
That's just like the secret sauce for increasing brain
Mhm.
plasticity, and it'll
Right.
decrease your overall sympathetic tone. Now, let me say a caveat here.
Mhm.
If this is balance and you are stressed, there we go, stressed, and you want to bring this into balance, you can either reduce the stress or you can increase the relaxation. You know what that's called? That's called being in the zone. This is the place where professional
Right.
athletes work. And we are all called to be in the
Mhm.
zone in our life. So
Mhm.
most often people experience this stress, but they don't move the relaxation piece at all. Instead, they,
Mhm.
whoa, do super
Yeah.
exercise. And they say that that's relaxation when actually that's exhaustion and it's draining your adrenal reserve. So You can work to reduce the stress with some focused exercise,
Mhm,
shaking again, dancing, or you can
mhm,
increase the relaxation tone, the parasympathetic, and that's vagal nerve tone. So that helps your blood pressure and your heart rate, that helps your gut, that helps your immune system, and all of this helps your brain be plastic. A key way that's shown to help people with attention issues is to do neurofeedback.
mm,
Neurofeedback helps
mhm,
train the brain, different parts of the brain to use. So, it trains you more to use that prefrontal cortex, that top down approach. It trains you there. And it also trains you to have more beta waves. Beta waves are the waves that are associated with attention. Often,
mhm,
folks with attentional issues have more theta waves, which are less
mhm.
organized, slower, and more freeform. That's not associated with focus. So,
Right.
neurofeedback actually helps you literally retrain your brain. It is biofeedback for the brain, and it can be very effective. Yoga,
I love
especially
that.
things like weighted yoga, can be helpful. Mindfulness helps bring that relaxation place into a better place of balance. It doesn't really help attentional or impulsivity issues as much as we
Mm,
might think it should.
mhm,
Usually,
mhm.
it's going to be movement and those places of neurofeedback. Mary,
Oh, I love neurofeedback. And for those who don't know or haven't experienced it, it's a fancy word, but it's very relaxing. It's great for kids and adults. And you're basically sitting with some monitors on your head and
electrodes.
watching a screen, electrodes, and yeah, monitoring brain activity, and you sort of adjust your level of, let's say, cognitive arousal according to what's on the screen. And it's very meditative but quite engaging. So for the ADHD mind, I can see that that would be a pretty profoundly useful tool. Very cool.
It's
Very
got some
cool.
good data. And if you were to
Yeah.
choose to put your investment into one therapy for mind body approaches, neurofeedback
Okay.
would be the one.
Okay. Based on research, we love that. Excellent. And it feels nice. Some people think, oh, it's scary. I'm going to have electrodes on my head. But actually, I've done it a bunch and I fell asleep once. It's great.
And they don't shock you.
Um,
So this they're not putting electricity
no.
into you, right? They're
Yeah.
actually just receiving where your brain is most active.
Yeah. With that, Henri, I would love to ask you just to zoom out a second about you mentioned the terrain in ADHD. I love this terminology and the visual. And you also mentioned that conventional medicine often misses the mark when it comes to diagnosing. Um, so I'm curious, what are some of the most common underlying imbalances you see in patients with ADHD symptoms, and what are your favorite diagnostics?
Okay. Well, we'll talk about
Mhm.
nutrition first. So, when you talk about the terrain,
Right.
then you're talking about these basic physiologic processes. And again, yes, unfortunately, conventional medicine waits for these things to be out of balance and diagnosable.
Mhm.
So, nutrition,
Mhm.
key. And then assimilation, which is all about how the gut works. Those two things often go together, very important individually and together.
Mm.
We talked about
Right.
that whole mind body terrain, how you can be more
Yeah.
resilient to stress and really be more focused on what your passion and purpose is. And here I really want to bring in this idea of connection. So we didn't mention that just
Mm.
now, but being connected
Yeah.
in a social circle, being connected to wherever you see yourself in the universe, if that means believing in
Mm.
a higher power or God, that's really important. All of those
Mm.
things are
Mm.
protective. Other things
Mhm.
that involve the terrain are things you're getting from the environment and how your body works with that. So, exposures and this idea of detoxification. Hormones
Mm.
are a piece of that, and not quite as important in ADHD. I mean, sometimes they can be helpful, but hormone replacement is not really a treatment for ADHD at this
Right.
moment. But that's another piece
Interesting.
of terrain.
Yep.
Inflammation and how your immune system works.
Oh,
And that is both
right. Let's dig
infections,
in.
which can set up that fire, inflammation. So these are key parts of the terrain, but nutrition is critical.
Of course. And
So
then
shall I go
how would you
into
go
it?
about, yeah, how would you go about testing where somebody is? For I'm thinking about our audience member who's curious about, okay, how do I test this? How do I understand it? But you take this in the direction that makes sense. We could talk about nutrition
So
if you like.
there are some things that are pretty common. So I do
Mm,
not test this out of the gate. I'm going to
okay,
tell you the questions that I generally ask, but
great.
but I usually do the focused functional medicine testing, not just like, oh, you come
Mhm.
see me and you get all these tests. I mean, that's a huge amount of money. That's a lot of an
Yeah,
investment. You're sort of
yeah.
shotgunning the process. You may get a lot of information, and it doesn't mean that every number that's a little bit out of balance needs to be intervened upon. The better way
Right.
to do it is to take a full history, the family history, everything that's affected, your primary relatives, and then your grandparents, and see how that may impact you as you move into the future. Part of that history are all of the different experiences that you've had, literally as many as you can remember. This will be
Okay.
your nutrition, how it has changed over time, what you've been exposed to, whether you've been bitten by a tick or lived in an old house or,
Right.
worked in a industry that has toxins or lived in a city that has smog or been
Yeah.
out in a rural area and your water is coming from well water in an area that has had mining. Or go out hiking and you're drinking water and there's been animals around, or any number of different things.
Wow.
All of these things push on our terrain and become a piece of our
Yeah.
history and can trigger our genes into expression. So, taking that
Mm,
full history, including that nutrition history, is critical. Let's put sleep and stress in that history and exercise as well. So, I ask folks these questions about their nutrition. And you might ask yourself these questions too as you're listening to this.
great.
How many reliable servings of non-starchy vegetables do you get a day? Reliable
Hey.
every day. How many can you count on? Not specific ones. This is not, oh, I eat 3 vegetables in this small little dish. That's not 3 servings. That's wonderful. That's
Two.
variety, and we want variety, all the
Yeah.
different colors, because those phytonutrients that give vegetables taste and color are the things that turn on our cellular capacity to heal. Critically important, cellular
Mhm.
capacity to heal. A serving, if you think about it, and this is for different people, so we're going to go by hand size. If you put your hands
Right.
together as a bowl, those are
Okay.
green leafy vegetables uncooked, not including lettuce.
Uncooked.
That's one serving.
Okay.
That's one serving.
Hey.
If
Good
you
to know.
do cooking that's sort of associated with southern US and you cook vegetables down to very small amounts, then one hand a cup tight. That's cooked down vegetables. Think of spinach,
Okay.
fresh spinach cooked. Okay. And then those chunky vegetables that you chop up, a loose hand. That's one serving. So, how many servings of non starchy vegetables do you get? And why do we ask about
Okay.
this? Because this
I was
is
just gonna
where we're
ask you.
going to get our magnesium. This is where we'll get some of
Mm,
our B vitamins. This is where we'll get our iron.
mhm.
Low iron is associated with ADHD. Low
Yes.
magnesium is associated with ADHD and all attentional issues. Um, and
Right.
and then the next question is, how much protein do you get?
Okay.
Generally, people are very deficient in protein, very deficient
Mm,
in protein.
okay.
So you should get about 1 to 1.5 grams of protein. Uh, you should get about 0.75 to 1 gram of protein per pound. So I usually
Right.
start if somebody has 200 pounds, that's like, I don't know, a little less than 100 kilos, then you should have about 100 to 140 grams of protein. And most people
Mhm.
will get like 40 or 50, right? Remember, an
Yeah.
egg is 5
Totally.
grams of protein.
Mhm.
And a piece of meat
It's
is about 8 grams per ounce. So if you get
Mhm.
a sort of 5 or 6 ounce piece of meat, which is about the size of a deck of cards, then you're getting somewhere around 30 grams of protein or a little more, depending upon the size.
Mhm.
So when you think
Mhm.
about
You
that,
really
you
have to
say,
focus
whoa,
on it.
not much
It's a
protein,
lot.
right? And then
Yeah. It's a
where
lot.
are you getting your carbs from? Now, here's where the numbers get so high that people don't even have an idea. And so I ask them just to be mindful and to shift their carbs from the white stuff, refined stuff, not good for you stuff, over
Yeah.
to complex carbs. I'd
Nice.
like to just
Great.
remind folks that non-starchy vegetables exclude any root vegetables, which are mostly carbs because
Mhm.
they're mostly starches, corn and peas.
Mhm.
And most people, when they get their vegetables, that's what they're eating: potato, corn, and
Mhm.
peas. So, so right there,
Yeah.
you can identify, whoa, this is quite a place for me to work to improve. Okay. Now, why is
Absolutely.
that important?
Yeah.
Because to create norepinephrine and dopamine, remember those two molecules that really are their dysfunction, their imbalance is characteristic of attentional issues. So to
Mhm.
create dopamine and norepinephrine, you need protein and you need vitamin B6. The B6 is going
Mhm.
to come from the grains. The cofactors like magnesium and zinc are going to come from the vegetables. And the tyrosine, which is necessary for the production, the tyrosine is going to come from your protein, but it doesn't come very
Yes.
effectively from vegetable protein. It comes from animal protein. And
This
mind
is
you,
a sticking
tryptophan,
point that.
the
Mhm.
basis of serotonin, also comes from animal proteins. So, do we need
Yes.
to do testing in order to identify this? No, we just need to ask those questions and have folks
That's a
work
great
on
point.
that. And it's
Mhm.
amazing how much better balanced folks feel when they get enough protein, when they get enough vegetables, when they take all of those simple refined sweets out of their diet. And mind you, the other thing to take out of one's diet is
Mhm.
inflammatory foods. Okay.
Mhm.
Processed food,
Mhm.
junk food, fast
Yeah.
food, fried food. And if you like your meat marbled, take it out. Inflammatory. So farm raised fish, inflammatory. So if
Mhm.
that's your diet, we can measure inflammation, but I can tell you have it. So work
Right.
to shift that diet. Inflammation, especially inflammation in the brain, keeps the brain from removing different kinds of toxins. Just keeps the brain from
Mhm.
doing it. Those cells don't work as well.
Mhm.
Right. So
Absolutely.
that is
Yeah.
going, inflammation is one of those things that decreases brain plasticity. So
Absolutely.
B6 is something we need.
Great.
Tyrosine is something we need. If we need to test, then you can do
Mhm.
micronutrient testing. That's a blood test. Lots of different companies do it. And it'll give you these amino acids. That's what tyrosine is. And you'll be able to see what you're deficient in. It'll give you your vitamins. It'll give you your minerals. And it also gives you these things called organic acids that look to see how well you're utilizing or if you're deficient in any of these vitamins and minerals. And so I do
Mhm.
often do this micronutrient testing if we've done the nutritional intervention and there's still something that we might be missing. Maybe there's some kind of a trace mineral that we need to replace with a supplement. Or maybe even with
Mhm.
the dietary changes, we're not getting enough effective vitamins. And here is where the MTHFR gene comes into play. So those folks with an MTHFR gene will have a hard time ultimately producing things like L-methylfolate on their own. And if you don't have L-methylfolate, you can't convert things like B6 and tyrosine into dopamine and norepinephrine. So very often that needs to be supplemented for those folks who have a genetic inefficiency. Um, I can keep going. We spend the rest of the time on
Yeah.
this. So
No, it's great.
So
There's many
one
things
thing
to
that
say,
we've
and
seen is that animal protein and saturated fats, those not so good fats, not the
mm,
polyunsaturated anti-inflammatory fish oil fats, but the other ones found
yeah,
in processed food and fatty meats,
yeah,
those things
yeah.
are directly associated with ADHD. So
Ah,
when there's a
interesting.
direct relationship shown by research that as you increase that,
Mm,
attentional issues are more likely. Now, conversely,
interesting.
when you have lean protein and you have more magnesium and more zinc in your diet and more B vitamins in your diet, it's shown to have it's shown to decrease the incidence of ADHD. So
Amazing.
dietary things are very important. And as part
Sure.
of your diet, the idea of having essential fatty acids, and you find that in fish. Okay, so
Yes.
eating fish generally for most folks once a week is a really great thing. But that is something that actually helps the brain become more plastic. And if you need to take fish oil, so if you can't take fish for some reason, or you don't like it, or you're not near a
Yeah.
place where you can get, reliable, reasonable, and healthy fish, then you might need to take essential fatty acids. This would be
Mhm.
generally at at a reasonably high dose, around 800 of EPA and 600 of
Mm,
DHA. The EPA decreases inflammation, the DHA builds up membranes, and
mhm.
phosphatidylserine helps that be
Okay.
more efficient.
Excellent.
I'm just going to
It's
pause.
interesting that,
I'm going to take a
yeah, it's
breath.
interesting. Like, you take a breath. I'm just observing how many of your guidelines here are very similar to how I would advise someone around general tactics for longevity. Similar
Mm-hmm.
amounts of protein, fatty fish or essential fatty acids at least 3 times a week, 3 times a week, however you get them, this kind of thing. Complex carbs that break down slower. For those who don't know what complex carbs are, they're just the ones with more fiber, not the white stuff. I love to say keep the white stuff minimal, like processed sugar, pasta, bread, all of that kind of stuff. And you spoke to minerals, magnesium, iron. It seems we're very much sort of neglectful of our mineral intake, and part of that is that there's so much of this artificial salt, this sodium chloride on our food now, and that's kind of where people are getting their minerals. But really, natural salt has 86, 89 minerals in that. So yeah, I'm curious your thoughts on getting people to shift, especially around packaged foods. Do you have them, how do you have them get their electrolytes or their minerals?
So yes, indeed, it is fresh wherever possible. Now, if you have a lot
Mhm.
of
Oh,
non-starchy vegetables in your diet, you're gonna be getting a lot of the minerals that you need.
nice.
There may be some trace minerals that you don't get a lot of, things like manganese,
Mhm.
selenium, those kinds of things. And then taking a trace mineral combination can be a useful thing. Your your
Mhm.
um, your micronutrient testing can identify whether or not your diet changes have given you as
Mhm.
many minerals as you need. So I
Right.
don't usually have people automatically take minerals. We will have
Right.
them take minerals if their dietary changes have not resulted in the kind of improvement that we would expect. When we think about agriculture and what we've done to agriculture, it is
Mhm.
it's really quite impressive. And yet, as humans, we're designed to be resilient, and that's always the point, right? The point is, okay, things have changed in how we grow our food, and yet um, it's not pervasively uh, toxic in terms of our immediate mortality.
Mhm.
Our food doesn't kill us immediately; it kills us over time. The standard
Yeah.
American diet, which has become the standard
Mhm.
Western diet, which has now become the standard world diet, all of
Mhm.
that is about inflammation. It's about
Mhm.
food that is produced in mass amounts. And we can take, for
Yes.
example, gluten. Gluten is not,
Mhm.
gluten is wheat is crossbred to increase gluten in the United States. The
Mhm.
wheat we produce has very high gluten, not because
Yes.
it's been genetically modified. It isn't genetically modified, but because we've crossbred it to increase the amount of gluten. And this sort of
Yeah.
transitions us into this conversation around gut health, because
Yeah.
you don't have to have celiac disease, a genetic inability to digest gluten, in order to have problems with gluten, right? Our
Absolutely. Yeah.
food has given us this, and it's cheap and easy, and gluten is in so many things. It's a food additive. You wouldn't think that there'd be any
Mhm.
kind of wheat products and things like ketchup or condiments, but it just thickens whatever it's in.
Mhm.
Okay, so it's a food
Yes.
additive, and you have to look at labels for this. Many people
Mhm.
eat gluten breakfast, lunch, and dinner, and in between. So gluten
Mhm.
and then dairy and casein is the dairy protein, tend to be the other piece of that inflammatory duo. And it is
Mhm.
because we challenge our gut so very frequently with this same molecule, gluten or
Mhm.
casein, that it starts to be like, enough of this already, right? I don't want you
Yes.
around. I'm going to start to react against you so that I don't have to
Yes.
absorb you. And over time, it actually breaks down that tight connection between these cells in our
Yeah.
intestinal tract. Remember,
Yeah.
our food is supposed to be broken down in our digestive tract into small pieces like amino acids, vitamins, minerals, tiny little fats,
Mhm.
carbohydrates, and then come through the cell into the bloodstream. And the body gets
Mhm.
only what the body needs. But when that tight lining between the cells breaks apart, larger molecules can come through. And when larger
Mhm.
molecules come through, we create inflammation. And
Mhm.
high
Mhm.
sensitivity C reactive protein, CRP, is a measure I
Yeah.
use frequently. Now,
Nice.
usually when it is a little bit high, then it's
Mhm.
related to essential fatty acid deficiency. So, lack of
Sure.
anti-inflammatory dietary molecules. And so, dietary
Right.
intervention is the first thing.
Mhm.
If it remains even a little bit high, it should be less than one. That should be less than one. I'll say it again, less than one, should be less than one. If it is more than one, it's associated with a shorter lifespan. It's associated with more cardiac events. It's associated with more brain events, including Alzheimer's disease. Inflammation reduces neuroplasticity. So then
Mhm.
we'll look at the gut. And it's very often there that we'll find things driving that place of full body inflammation. Now, that
Mhm.
could be gluten sensitivity. It can increase a molecule called zonulin, which happens when these cells break apart. And that tells you that you have a leaky gut, which means that you're not
Ikea.
effectively absorbing the foods you eat, and you're often creating inflammation to the foods you eat the most, even if that's the
Mhm.
most healthy foods. If you have
Mhm.
an inflammatory situation in your gut with permeable membranes in your gut, whatever you eat the most, you're going to be reactive to. So I suggest people
Mhm.
do a rotation diet. Now, that's a big piece of
Okay.
work because most folks really just eat gluten and eat wheat and dairy. So this means not eating anything more than 2 or 3 times a week. Any form of wheat,
Okay.
any form of dairy, any kind of meat, any kind of vegetable, rotate it.
Mm.
Give your gut a chance to
Okay.
not have to react to the same thing every day,
Gotcha.
multiple times a day. Whatever we do to help the gut heal, you still need to give it a break from all of that hard work that it's trying to do. So when
Mhm.
there
I love
are
that.
food sensitivities, then getting rid
Yes.
of gluten and dairy are the top two things I ask folks to eliminate. And this
Mhm.
works really well with kids. It works really well with adults. It can help
Great.
them focus better.
Right.
So there
Amazing.
are other things that you might be sensitive to, and more intensive elimination diets may be necessary. But I start
Mhm.
with
Right.
gluten and dairy. For
Amazing.
most people, including kids especially, getting the
Mhm.
preservatives and the dyes out of their food, so eating clean, healthy, and natural as close to
Mhm.
your location in season as possible will be great.
I'm
The other
glad you
thing with the
mentioned that.
food, and it goes sort of
Mhm.
into this idea of toxicity, is that
Mhm.
organophosphates have been linked to attention deficit.
Right.
And
Pesticides.
we have pesticides on practically all of our food. So
Yeah.
that's an important thing to explore. So exploring
Mhm.
that, I usually do something called a total toxin screen. There are many different companies who do
Mhm.
this. They'll look for mycotoxins, they'll look for chemicals, which include pesticides, and they'll look for metals. And of these
Okay.
things, three things have been associated, and there may be many more that we haven't quite formed the association, but the
Mhm.
organophosphate pesticides,
Yeah.
PCBs,
Oh,
polychlorinated biphenyls, PCBs,
yeah.
and lead are the
Hey,
three big
interesting.
toxins. You live in
Mhm.
an industrial area, you may have PCBs. Any kind of an
Right.
old house, if you are older than about 30, then you will have lived in a time when there was leaded gasoline and leaded paint. So those things, and these things accumulate.
Yeah.
PCBs accumulate, and it is hard to get rid of them because they
I mean,
really do stick around. Lead, easier to get rid of, but it might have been an
mhm.
exposure that happened when you were far
Mhm.
younger. You might say, where am I getting it
Right.
from? Well, you might not be getting it from anywhere. You may be living in a newer
Mhm.
house. You may have filtered water,
Mhm.
not do any kind of painting, not do any kind of stained
Mhm.
glass, not work in a smelter.
Mhm.
Um, Eat food that's organic and still have lead, because lead is not something that is immediate. Now, we talked about
Absolutely.
fish and fish oil. So
Yes.
mercury is related to neuroplasticity. It hasn't been directly related yet to attentional
Mhm.
issues. But
Okay.
for folks who eat a lot of fish and who
Mhm.
have problems with that overall non-starchy vegetable protein balance, then we can
Mhm.
bet that they're not going to detoxify as well as they should, and they'll have high mercury. This is especially problematic for nervous issues, brain issues, pain. So,
Mhm.
working
Mhm.
to understand our toxic exposures over the course of life, and then ultimately working to detoxify, important for attentional
Mhm.
issues. And
Mhm.
again, I
Absolutely.
have talked, and you might think I didn't breathe once, but
Oh, it's amazing. Yeah, no, it's all welcome. Thank you. And I'm gonna keep going on this thread since you've introduced it so elegantly. Can you speak to how to detoxify these kinds of chemicals from the brain, from the body, since it's not
yeah,
quite that straightforward?
and
And that will
and I
be our
will,
last question before we
yeah.
wrap up.
Well, and I do want to mention one other thing. Let me mention it first, and then I'll go
Yes,
into that.
sure.
So there are
Great.
some botanicals that have been shown to be helpful for attentional
Great.
issues. One is the
Okay.
combination of ginseng and ginkgo. That actually is one
Hmm.
of the best researched combinations for ADD, ADHD. Another thing
Amazing.
to think about is bacopa.
Yeah.
And here's an unusual one that we don't usually hear mentioned, saffron.
Mhm.
And then
Really?
rhodiola.
Hadn't heard that one.
Yeah,
Okay.
exactly. There's good
Yeah.
data around
Interesting.
saffron. And then rhodiola.
Interesting.
And
Yeah.
sometimes one of those trace minerals that we don't usually get very much at all, unless we live in areas that have these rare earth minerals, as we hear speak of so much, is lithium. And sometimes taking a little bit of a lithium supplement can help. So those are
Should
things
take
to think
low dose
about.
lithium.
Talk with your
Yeah.
provider, talk with your
Hmm.
coach and your navigator to see whether or not this would be
Hmm.
useful for you. And whatever you
Right.
do, make sure you
Hmm.
coordinate what you do with whoever is your medical provider. So, and
Yes.
this involves
Great.
detoxification as well. it's very in
Mhm.
vogue that you go and you do these detoxes, right? And I read about this detox. I'm doing this detox. I'm doing
Fine.
15 days
Yeah.
of this, 30 days of that. I feel awful. Well,
Yeah.
it's not working, right? When you feel awful, that's not detoxification, that's retoxification, right?
Mhm. Mhm.
Detoxification should not feel awful. Key thing, bright lights, red lights. If you feel
Yeah.
awful while you are detoxifying, you are going too far too fast. You've missed key parts of your detoxification
Mhm.
process. It isn't keeping up with what you're trying to do. So please
Mhm.
don't do it. It means that you're asking your body to release more than it can ultimately eliminate, and it's being
Mhm.
reabsorbed into your body. Okay.
Mhm.
Detox does
Yes, good
not
point.
require retoxification. How bad you feel is not a measure of how well it's working. Please, please remember that. Please.
Great point. Yeah, very important. Trigger
So,
yourselves to release the stuff. We got to help your body to
yeah,
clear it out. In other words, yeah,
because when you think
great.
about detoxification, it's what you're bringing in historically or currently, right? Your load. And
Yeah.
then it's having
Mhm.
enough vitamins and minerals for the liver, largely the liver,
Mhm.
to work to transmute it so that these things can be taken out. And they're taken out sometimes through the skin. So sweating and dry brushing is a
Mhm.
good thing to do.
Nice.
Sometimes through the urine, mercury is a good one for that. And most
Mhm.
often through the gut. So, that
Nice.
is regular, soft, easy elimination. And if you aren't
Mhm.
having 1 to 2 easy, soft, quick bowel movements a day, bowel movements that are formed, you sit down, you get up, it takes a minute, no work necessary, then
Mhm.
you have to wonder
Mhm.
if you're going to be detoxifying well enough. Anything, your hormones,
Absolutely.
any
Mhm.
medications, any chemicals from the outside, your gut is not sufficiently working to eliminate effectively. So that causes a
Mhm.
backup and a reabsorption of material that the liver is trying to get rid of. So you have to think of it from
Mhm.
all three of those places. Bottom line, first
Mhm.
thing is make sure the gut's working. Don't even start a detoxification process until you have that kind of bowel movement that I described. And if you don't have it, that's an issue in and of itself that needs to be addressed first. And then you
Absolutely.
take different kinds of supplements that can support the liver. And so you work to support the liver. You can start doing things very gently with, for
Mhm.
example, a green smoothie. A green smoothie with things
Nice.
like dandelion, kale, chard, different kinds of greens as the mainstay, some protein powder, and there are different kinds of detoxifying different kinds of medicinal foods that contain protein and different kinds of herbs and vitamins and minerals to support detoxification.
Mhm.
I often use those with folks as
Nice.
part of that smoothie as the foundation of the detoxification. And then you add different kinds of binders. Sometimes those binders are medications, and those tend to be fairly difficult, but they're not very specific. So, really, you need to
Mhm.
test. You need to see what you're getting rid of. You can't just say, I'm doing a detox because you don't know if you're getting rid of mycotoxins or chemicals or if you're getting rid of different kinds of metals. And there are different agents that are required for each of those things because those things have different sizes and different charges, and one size does not fit all. So you have to
Mhm.
tailor your detoxification binder to whatever it is you're targeting. And mind you, those binders bind, which means if you had a little
Yes.
problem with constipation before, then it wouldn't be surprising for it to come back when you're taking the binders.
Yes.
If that happens,
Yeah.
you stop until you resolve the constipation. Okay. You gotta have a
Mhm.
clean, easy, complete bowel movement, no pellets, no clumps together, clean, easy bowel movement
Right.
for things to detoxify.
Can be complicated as you've spoken to. So it's certainly something you want to do under the guidance of a medical professional, actually, especially with the binders and toxins coming out. Yeah. Perfect. Okay.
We've
All
covered a
right. This
lot
has been
today.
We have. This has been fantastic. Thank you. This could be a 2-hour podcast. I have so many other questions, but we're gonna sort of bring it all back together. And actually, I will just ask you one quick, tiny thing. Um, what are the top 3 non-negotiable lifestyle habits you recommend across the board for ADHD support? And then we'll wrap.
Exercise. Number one, exercise. Okay. You can't get away without exercise, regular exercise, including some high intensity exercise. Number two, nutrition. You have to work with that
Mhm.
nutrition. You have to get enough protein, enough non-starchy
Mhm.
vegetables, throw nuts in there for other trace minerals,
Mhm.
fish for the essential fatty acids, and get rid of the bad stuff. So those
Nice.
two things for sure. And then work on your vagus nerve. Work on strengthening
Love
that
it.
parasympathetic
Yeah.
system, right? Work on the
Great.
neurofeedback,
Yes.
work on the weighted yoga, but strengthening the vagal
Mm.
nerve also includes things like doing twists, doing singing and humming.
Mm.
And there are vagal nerve stimulators, actual devices
Mhm.
that can help you do it.
It's just so really interesting, so easy, almost a zero effort way
Well,
to get
when you
into
do
that
these
part of the nervous
things, I
system.
have seen many people get so much better, and many people
Mhm.
be able to reduce their overall medication load. So,
Love
it's
that.
not just about maybe not going on medication and feeling more focused. It's also on not stressing the body with medication, um, if it's not needed. And Mary, as you said, these things are the same things that will help you live healthier longer. Because,
Thank
the
you for
first
all
key
of
step in
us.
longevity is
Mhm.
health in the moment, right? If you have chronic
Mhm.
disease,
Mhm.
no pill is going to help you live longer. So, working on
Yeah,
these challenges now helps you be more successful in the long
absolutely.
run.
Absolutely. I like to say that the way you live now will dictate how you feel when you're 80 years old and beyond for
Absolutely.
those of us who aspire.
Absolutely. I don't know if
Yeah.
I
Cool.
am backwards or not here. Can you see this? Or it's backwards. You see what it
Break
says?
out of backwards. No, what does it say?
Oh, it says let that shit go.
I love it. Bam.
There you go. Oh.
On so many levels. On so many levels. That's
Oh,
advice to live by, folks.
it has been a
Oh,
pleasure being with
it
you here
has been a
today.
real pleasure. Thank you, Dr. Roca. This has been amazing and a very enlightening conversation. Thank you so much for sharing with us. And thank you, everybody who has joined this podcast live and who are going to watch it in the future. Before I wrap up, we'll let you know about the next podcast and practical longevity newsletter. If you haven't signed up, you can find that at wellme.ai. And for our audience, Dr. Henri, where can they find you?
They can find me at onemedicinewellness.com.
Perfect. Thank you. You have an amazing
Mary,
practice that
if
really
people want to
shone
send
today.
questions in, not specific but general questions, then you can send them on to me.
Oh, that's amazing. Thank you. Wonderful offer. Thanks, everyone.